Hello, everybody. Welcome. I hope you're having a good day. So we are going to dive into health insurance today. And health insurance is an important one. I know it's going to be tempting to just zone out, but please don't do that. Please get off your phones and watch because health insurance is important. We're actually going to spend 2 days on health insurance. This is a big one. Everybody needs it. At some point, you guys are all going to have to get your own. Currently, under current laws, you can stay on your parents' health insurance until you're 26. I don't know if that's going to continue to be the case, but you have many years after your 26th year where you're going to need to understand all this. So let's go ahead and dive in. All right, question of the day. How much does the average overnight hospital stay cost? So think about that. Come up with a number in your mind. What do you think it would cost you if something happened and you had to be in the hospital overnight? I'll reveal the answer on the next slide. Here it is. All right, a little less than $12,000. So if you end up in the hospital, depending on what kind of insurance you have, it could be anywhere from $13,600 all the way down to $9,300. It kind of depends. So Medicare, that is health insurance for the elderly, people who are over 65. That's what they've listed here on the far left. That would cost you the most. That would be a $13,600 stay. Medicaid is health insurance for people with low incomes. For most of us who get our insurance through our jobs, that would be private insurance, and that would be closer to $11,000. And notice that the cheapest is if you are uninsured. If you add in all the other types of insurances there are and you take the average for all pays, all stays, the average is $12,000, about $11,700. All right, so here's some questions, some things to think about here. Even though the total cost of an uninsured hospital stay was lower, why would it actually end up costing more than an insured hospital stay? The answer is that $9,000 would be completely on you. You would need to figure out a way to get that paid 100% out of your pocket. For all those other stays, whoever that person is who had the insurance, they are not going to pay that. They're not going to pay $11,000 because insurance is going to split that cost with you. So it is going to still be significantly less expensive if you had insurance. Now, why do the costs differ so much depending on the type of insurance you had? Well, because different insurance providers negotiate rates. So what happens is, you end up having to have a procedure, going to the hospital, whatever, and then the hospital bills you this kind of like face value amount, which is usually really high. And then that gets submitted to insurance, and then the insurance company negotiates a lower rate for you. And different companies have different things that they've negotiated. So a lot of times, and not always, but a lot of times some of your big providers that are, really nationwide, like Blue Cross Blue Shield, have the ability to negotiate better rates and lower rates. Is it a good idea to save money by not paying health insurance? No. And hopefully by the end of this video, you'll have some clear idea as to why that is. All right. So throughout this presentation, there are video links, and typically I would have just linked to them, while we were in the classroom, but since I've recorded this video on YouTube, I'm just going to include the link in here, and it should be linked below. So you're going to pause my video and watch the other video that I've linked here within YouTube. So go ahead and pause this and watch the first video on understanding your health insurance costs. All right, so now that you've watched that video on health insurance, let's talk about how much you might actually pay once you enter that copay phase. So remember, the video talked about the fact that you have your deductible, right? We know from our first conversations about insurance that the deductible is that out-of-pocket amount that you have to pay before your insurance starts paying the rest. Now, I will say that the numbers they used in that video were very, very, very low. I'm sure they were doing that just to keep things simple. But I did look it up, what the averages are for a deductible and an out-of-pocket maximum in 2024. So the average deductible these days for an individual, if it was just you, is $5,000. For a family, the average deductible is $10,000. As for that out-of-pocket maximum, for an individual, it's closer to about $9,500. And if you're a family, it's about $19,000. So reaching that out-of-pocket maximum would be, if something kind of big happened for you that year. Now, when you're in the copay phase, before you've reached your out-of-pocket maximum, the amount that your insurance is going to pay versus what you're going to pay, that depends on the type of plan you got. And usually in terms of how much is going to be paid, we use a metal system for that for whatever reason. So we go platinum all the way down to bronze. And these are not, if you have, say, a bronze plan, it doesn't mean that you're going to get bad health insurance, right? Or bad health coverage, I should say. The quality of care that you're going to get would be the same. I mean, you're still going to the doctor and getting hopefully good quality care. It just means that when it comes time for you to pay the bill, you're going to be paying a higher percentage of it. So if you had the best plan out there, that would be a platinum plan, and that means that the insurance during the copay phase would pick up 90% of the tab, and you would only be stuck paying 10%. Now, we know that there is a relationship between premiums and deductibles. There's also going to be a relationship here between premiums and the level of actuary value you have in your plan. So I would imagine that a platinum plan has a very high monthly premium. Now, gold and silver are going to be more typical. It's very common for your insurance to pay 80% and you are on the hook for 20% of the bill. That's kind of been standard for a long time, that 80-20 split. But silver, that is pretty common too, where you would be paying 30%. And of course with bronze, you're on the hook for paying 40% of your bills. So here is a hospital bill example. I mentioned that they sort of negotiate this lower rate for you. This is just something I pulled off the internet. And this would be for someone who just had a baby and had the baby in the hospital and so therefore needed to stay there probably overnight somewhere in Pennsylvania. So if you look at what the hospital actually charged, if you look down at the totals at the bottom, it was quite a lot of money. The anesthesia was $1,500. The labor and delivery itself was over $21,000, and the use of the room was $13,000. It's pretty big. However, take a look at what the payments were and what the adjustment was. So that second to last line, the insurance company paid $8,000, and then the insurance adjustment was $35,000. That's what I'm talking about with that negotiated rate. So when, they said in that first video that when you pay your premiums, you kind of get entry to the club. Well, the club membership also gets you this lower negotiated rate. So you get this kind of steep discount. So when all was said and done between the copay and the lower rate, this person actually is only going to have to pay about $900 for the birth of their child. Okay, so what if you're going, Ms. Verdugo, this sounds like a whole lot of money, and how can I get away cheap? I'm very healthy. There is something called a catastrophic plan, but they are typically not really recommended because, as you can imagine, they only are going to cover you in the event that something really bad happens, and they're not going to cover much else. So it's considered risky because a lot of things can happen that still cost money but aren't catastrophic. Typically, these are only available to young people. You gotta be under 30. The only way that you would qualify for one of these kind of plans is if you were older, is if you'd experienced some kind of financial hardship. But here's the scoop. If you experienced financial hardship and you're over 30, you probably qualify for Medicaid. Remember, Medicaid is health insurance for people with lower incomes. So that would probably be a better bet for you than a catastrophic plan. All right, so this is where it starts to get a little more complicated, and we'll talk about these kinds of things a bit more tomorrow. But what kind of health insurance plan should you get? It's not uncommon when you get a job and it's time for you to pick health insurance that they are going to offer an HMO, a PPO, maybe something in between, and you need to decide what works best for you. And it really is about what works best for you. There's no right or wrong. So starting over on the left-hand side, the HMO, and then on the far right-hand side, the PPO. Those are the most common. Those have been around for a long time. The HMO, that stands for Health Maintenance Organization, that doesn't work for everybody. it's pretty restrictive. My parents have an HMO and they love it, love it, love it. I personally wouldn't want to go for one of these. So again, no right or wrong. It just depends on your needs. So the thing about an HMO is there is this network. There is like one network of doctors that you can go to for hospitals, for everything, and there is no coverage outside of that network. If you need to see somebody that is not in your network, then you're kind of out of luck. It's like not having insurance. The other one thing is that referrals are required. What that means is that, let's say, I don't know, you have something going on, you need to see a dermatologist. You know you need to see a dermatologist. So with other plans, you could just go look up, dermatologists that take your insurance and give them a call and book an appointment. But not with an HMO. You have to go get a referral from your doctor. You make an appointment with your regular doctor. You go in and talk to them and say, hey, I need to see a dermatologist. And then they basically give you permission to go see. They refer you, and you are then allowed to make the appointment that you need. So that's pretty restrictive. But here's the thing, they are the least expensive. So you're going to get the care you need if it's a big enough network, but it's fairly restrictive and pretty inexpensive compared to other types of plans. Now, the EPO and the POS are something in between an HMO and a PPO. It's kind of a mix. So with the exclusive provider network, you still don't have any out-of-network coverage. However, you can just go directly to a specialist. No referrals required, and they're typically a larger network. With the point of service plan, it's kind of the opposite. Out-of-network coverage is available. Now you can go outside your network. However, you're still going to have to go see the doctor to get that referral, so somewhat flexible. What I personally prefer, what is pretty common, but not everybody prefers this, is a PPO, Preferred Provider Organization. So this gives you the most flexibility. There is out-of-network coverage. If you go outside the network, usually those doctors are more expensive, but you do have coverage and no referrals required. Just, look up on your plan who accepts your insurance and book an appointment. For that flexibility, though, you pay a higher cost. So this one is the most expensive out of the ones that we're talking about today. So once again, I've got a video. This summarizes what these differences are and gives you some visuals. So pause my video and click on the link. All right, health insurance is expensive. I'll show you when we are hopefully together on Tuesday. I'll show you what Plano ISD offers me and how much that costs, even with my benefits and lowered rates. So it can be a lot of money. And one of the ways that people deal with that is something called a high deductible plan. Remember that relationship between premiums and deductibles. If you go for a high deductible plan, your monthly premium will be lower. However, more out of pocket upfront. But there's something that you can do called a health savings account if you do have a high deductible plan. And a health savings account is where you have a little bit of money taken out of your paycheck every month, and it's pre-tax, right? So that's good. It actually lowers your taxable income. And that goes into an account, and they send you a little credit card. And this little credit card, this account, can be used for any health-related thing. So it's not really a credit card, right? It's more like a debit card because you're using it to draw on the money you're accumulating in your health savings account. But you can use this and swipe it to get, your prescriptions or all kinds of things that are related to your health. So, once you accumulate some money in there, you can use that to pay for that doctor visit, that maybe you're having to pay out of pocket. So a health savings account can be a great way to deal with the high deductible plan and kind of manage those expenses. And that's your money, so you can take it with you when you leave to go to another employer. All right, so last video, this is the opportunity cost of choosing not to buy health insurance. And one last time, pause this video and watch the next one, and then I have one last thing to talk to you about, how you handle it if you get stuck with a bill that you can't pay. All right, pause, I'll see you in a second. All right, let's say you end up with a bill you can't pay. That, unfortunately, is a really common problem. So bankruptcy is something that you file when you can't pay your bills, right? And you are just stuck and you're completely out of money. 60% of bankruptcies in this country are filed because people have medical bills they can't pay. It is really a problem. And this is why you want to have insurance. But let's say even with insurance, you end up getting stuck with something that's just outside of what you can comfortably pay from month to month. Here's what you do. You do not avoid paying, because that could ruin your credit, right? Number one, you negotiate a payment plan. Give them a call, let them know what you can afford, and do that right off the bat before your debt becomes a problem. A few years back, I went to the emergency room for something minor, but even if it's minor, it was a couple $1,000s. And what I did is I didn't even like, the very first thing I did is I picked up the phone and I said, I want to break this up into 12 monthly payments. And that was interest free. And they said, sure, they're happy to do that, right? Because they want to get paid. So, make monthly payments. If this is a bigger deal than that, and that's not something that you could easily do, you can actually call up the hospital rather, and ask for financial assistance. This is, like I said, kind of a big problem that we have this much, financial distress over medical bills. So hospitals have financial offices, and they can work with you. Sometimes there are programs where they can actually help offset the expense if you qualify. And the other thing is, I've mentioned Medicaid a few times, and Medicaid, of course, is health insurance for people who have low incomes. Let's say that you technically had qualified for Medicaid, but you just hadn't done that, right? It hadn't occurred to you that you might need that. You can actually apply for Medicaid, and then if you qualify, ask them to retroactively make payments. That is a possibility that they could cover some of your past due bills. Now, in this one last slide, this discussion questions, I think I kind of already addressed this first question. Why might your creditors rather work out a payment plan with you rather than just sending you to debt collections? If they send you to collections, chances are they're not getting their money. They'd rather work out a payment plan with you. Go into it knowing that that's the situation. And they probably want to work with you. Also note that none of those three strategies suggested using a credit card. No one suggested transferring your medical bills onto a credit card or taking out a short-term loan, because then those things come with interest, and you are going to end up paying way more than whatever the bill was by the time you've paid the principal plus the interest, the added fees for borrowing money. So like I said, when I had that $2,000 bill, and the reason I just called them up and said, divide it by 12, please, I will pay it off over the course of a year, it's because that was an interest-free option. And they will very much do that for you. They usually have a time frame that they want you to get that payment handled within. But if you can do that, then it's interest-free. So look for other things besides taking on debt, more debt. That is not a recipe for success. Of course, this class in the future will go into those kinds of details about debt in a lot in much more depth. But that's where we'll leave that. So have a wonderful day. And I hope you learned a lot, and hopefully I will see you tomorrow.